I want to thank everyone for coming on the call tonight and welcome everyone to our neck pain workshop. I recognize some faces that were with us earlier in the day from our shoulder pain workshop, and I'm really excited that you guys decided to hear more about the neck. So, like I mentioned before, there is a little bit of some carryover between neck and shoulder, and as we always say in our office, you really can't just treat the shoulder. You really just can't treat the neck. You got to treat everything. So I think we'll get into that a little bit more. And just one other quick thing, we're going to. It's going to be on Monday. It won't be tomorrow. We will have send you all a copy of the presentation that we'll go through, as well as the 4 key exercises for neck pain that you can start working on today, actually. And then we're recording the event too as well. So we'll also give you a little link. So if there's a part of the presentation that you might have missed, or you want to go back and just look at it again, you have access to that as well. So I'm going to start by sharing my screen. Katie, can you see that okay?
Yes, we can see it.
Awesome, great. Okay. So my plan for today is first off to just talk a little bit more about myself. We're going to talk a little bit about some of the statistics that we normally see about neck pain. We'll get into the anatomy of the neck, and we'll talk about the 3 top neck problems that we see very frequently in our clinic. We'll talk about posture, as that's something we spend a lot of time talking about in our office. We also talk a lot about breathing and chronic pain, and I'll explain why in a little bit. There are some things I think sometimes that we do when we're in pain that make our pain worse, and we have to talk about better managing that. Obviously, in physical therapy, we're always focused on exercise and getting people doing exercise. So then we really think it's very important that you have some long-term fitness goals. And we'll talk a little bit more about that towards the end. So my goals for the presentation for you guys is, one, just for you to learn more about the neck, so you can be a little bit more educated, know a little bit more about the anatomy and some of the things that we do in physical therapy. I say this in all of my presentations that I do. I don't believe that anyone needs to live with severe pain. I do think that there's ways for us to treat pain. And I definitely think that when it's done correctly, it can really improve people's quality of life, which I think is super important. I always think you should seek out medical advice from a qualified professional. The amount of times that I've been told in my office, well, my neighbor said, or my cousin said, or my sister said, unless they're a medical professional, I really want you to make sure that you're getting good information from people that have proper training and know exactly what they're talking about. And, we're not the only providers out there. There are plenty of other providers, plenty of other fish in the sea. My wife has an acupuncture company that's very close to our Northborough office. It's actually right behind it. We work with massage therapists. We work with local chiropractors. We work with a lot of physicians that can help with pain management and can help with other things. And I think it's really important that you get some quality assessment from people that do the work on a daily basis. And then most importantly, I want to make sure that you have some things that you can start working on right now. So we give you some easy things to do to start with that you can start doing tonight. So just talking about the numbers, neck pain ranks in the top 5 disorders in the United States. 10 to 20% of people having some incident of neck pain. 54% of individuals have experienced neck pain within the past 6 months. And the interesting thing is the prevalence of neck pain increases with age. It's most common in women around the 5th decade of life. 37% of individuals who experience neck pain will report persistent problems for at least a year. So this is not generally something that we see that's an acute injury. More often than not, most neck pain problems we're seeing, someone's had that for weeks, if not months. So we're looking at the picture of the spine. And up, obviously at the top, we don't have the skull in the picture, but it shows our first 7 vertebrae, which are our cervical vertebrae. Cervical is also the same thing as neck. The middle section is the thoracic vertebrae, and then the lumbar and the sacral vertebrae is what we think of lower back. That's what we think of. We're gonna, focus most of our attention up in the neck, but as I talk all the time, you can't just treat the neck. We've got to talk about the thoracic spine. There are many muscle groups that actually have attachments down to the pelvis and up into the thoracic and cervical spine. So we have to talk about all of those. I describe the cervical vertebrae as they're the foundation for the head. So if you think about the cervical vertebrae, it's like the first floor. And so the first floor, if it's off kilter, is going to make the second floor shift. It's been in a house that's kind of old and the floors aren't level and things aren't flat. Well, obviously, upper levels shift based on what the lower levels do. And I honestly think of the thoracic spine as kind of the foundation for that first floor neck and the second floor head. So when our posture becomes more forward head, we can easily expect that the first floor cervical spine and the second floor head is going to follow suit. Just as you see in this lady here, she's very rounded through her upper back area. It's what we call, normally we have a normal, what's called a kyphosis, but sometimes that can get exaggerated and really accentuated, as you can see with this lady on the left. And so if her thoracic area, her rib spine area is forward, her neck will be forward, her head will definitely be forward as well. So let's talk about some conditions that we see very, very commonly in the clinic. The first one is the fancy term for spine arthritis is spondylosis. In our office, generally, not always, but generally, it's mostly with people that are over 50. It tends to be more women than in men. Their general complaints are, I just have a really stiff neck. And they may talk about kind of like, pain, not only in the neck, but they may, talk about the top of their shoulder. They may describe some discomfort in their shoulder blade area. Occasionally, there's some complaints of headaches, not always, but occasionally. And generally, there's also the sense of just, I sit all day long, I'm behind the computer all day long. So if we look at the picture on the left side of the screen, what we're looking at is vertebrae, those spine vertebrae. In the brown is the bone, and the kind of purplish color is the disc. And so you see how the disc sits in between each bone, and that disc is a shock absorber. Think of it just like that. And when we're 25, it's what the normal disc looks like. It has good shape all the way through from front to back. It's equal on both sides, and it's got strong shock absorption forces available to it. As we age, a lot of the disc is water. So we tend to dehydrate over time. So do the discs. And so you can see that in that second level down where it says degenerative disc. So we end up having issues where the disc may flatten some. You can see it's a little bit more narrower. There's sections of it where it may be intact and other sections where it may not be intact. Sometimes that disc can push in a direction. And so you see what looks like maybe a pearl towards the back of the spine. And what you should also focus on is the holes. As if we look at the picture on the left side of the picture, we see if we were to put our hand back in our spine and we poke back there, what we're feeling is the knobs on the left side of the picture. And inside, one vertebrae sits on top of the other one and forms that small hole that you see the white area with. So out of that white hole is where the nerve exits the spinal cord and then goes somewhere in the cervical area down somewhere into the arm. So picture this bulging disc that should be looking like the top one, but is just pushing out to the back and pressing on a nerve. We'll talk about that in a minute. sometimes that bulging disc can, what we call herniate, or get even larger and push out even further into that space, creating more compression on the nerve. We talked about the disc kind of degenerating. Sometimes it can get thin. And then sometimes down the two lower sections, we can get some bone disruption. So now the bone is no longer having that smoothness to the top and bottom. It's a little bit more jagged. That bottom section looks almost like a top hat. So that's something that physicians look at many times from plain film x-rays. Is there any of that kind of modeling of the bone because of compressive forces that it looks very much like an old top hat? So what do we do with our patients that come in with, this problem of spondylosis or some cervical arthritis? We do a lot of work on posture retraining. They're almost inevitably everyone coming into, I actually can say that without a doubt, 100% of the people we see, their head is forward, their shoulders are rounded. So we do a lot of muscle retraining. We do a lot of try to reduce some of the tension that people carry in their shoulders and their trap muscles. We talk a lot about pain management, and we let them understand that pain is normal. We want people to know that pain is a normal offshoot of the body kind of protecting itself. We'll talk about that in a little bit. We'll add in some strength training, and along with strength training, we do a lot of aerobic conditioning. And so, we're not only working on trying to encourage people to work on making changes with their posture, we also want them out and moving. And so many times people just are afraid to do anything, but we're like, no, listen, get outside. Like, this is a perfect time of the year. I mean, right now it's pouring rain out, so it's not great now, but the spring is a wonderful time for us to get outside and get back to our normal daily activities outside. And we encourage that a lot with a general walking program. So I'm gonna stop sharing my screen for 1 second. We're gonna get into our first exercise, and let's find it here. Sorry. Just see if I can pull it up. Okay, let's see if that works. Yep, there we go. And so those of you that were on the call for the shoulder workshop this morning, this was one of our exercises that we talked about today earlier. There is some audio with this, but we had some trouble with it early today. So I don't know if it was work, but I'm going to play it anyway. And so I just want you to pay attention to this young lady is pulling her shoulder blades back together, feeling like those shoulder blades are kind of trying to touch back together in the back. So just watch her. So you can see, from her pulling her shoulder blades back, she's not shrugging her shoulders up. She's just trying to pull those shoulders back. Many times people that are in a lot of pain in their neck, they just really tend to, let those shoulders shrug up, almost like bringing their shoulders towards their ears. And that's kind of a bad position. We want to try to avoid that position as much as we possibly can. Oops. So the next problem we tend to see a lot of is something called cervical radiculitis. That's the technical term for someone having not only just pain in their neck, but also some pain in their arm as well. And we talked a little bit about the anatomy earlier. We had those spines stacked up on top of each other. Now we can see from this top picture here, this is the bottom of the skull, and here are the 7 cervical vertebrae in through here. And you'll see that little yellow piece of linguini coming out. That's actually not linguini, but it's one of your nerves. And so each one of those nerves goes somewhere, either in the neck, chest, or arm area. So you can see how, as an example, here's the 6th cervical nerve root innervates the outside of the forearm and into the thumb. So when people come in with really very specific pain in their arm. Like I have this, as my thumb is numb or tingling and it goes into my forearm. That's when we kind of start thinking, well, maybe it's not an arm problem. Maybe it's probably coming from their neck. And so we'll not only look at their arm, their wrist and elbow and forearm, but we'll also spend a lot of time in their neck as well. And so in this lower picture here, we're looking at that's kind of an odd picture, but we're still looking at those same vertebrae. Here's that same spinal cord with that same linguini coming out. And here's a disc that maybe is herniated. And you can see how it can press on that nerve, presses on the nerve, sends those symptoms down the arm. So these people generally, they're actually a little bit younger. They're maybe more than 35, have neck pain, have some arm pain, maybe some tingling or numbness. And it's usually very specific. They'll come in and say, oh, my thumb is, the tips of my fingers are very tingling, or I feel it, some tingling in my arm. They generally have trouble with sleeping. Again, they're also usually have very poor posture. They're very sedentary, do a lot of sitting at work as well. So what do we do with these people? Well, we try to create a lot of distraction, and we're thinking this problem is coming from compression, from bad posturing, forward shoulders, rounded head, creates compression in between the vertebrae. Well, we try to say, let's see, can we distract those vertebrae and create some space in between the vertebrae? And so what we focus on is, again, pain management. We do a lot of our manual work. We'll do some massage and stretching and some mobilization to the joints in the neck and the upper back. We, again, talk about posture. Again, we'll do some strength training as well. And we may also end up doing some cervical traction, and that's the lower picture. So this young lady is on the cervical traction unit. It's exactly the same unit we have in our office, in both of our offices. And she lays down on her back while this machine is guiding her neck up the track and down, pulling in pounds of traction. And so that distraction of the neck usually is very, very comfortable. Most people like how that feels a lot. And it can be a great way to take that pressure off the nerve that's being compressed. So here is our second exercise. And this is for the neck. I'm going to show you two variations of it, because one is sitting and one is laying down. And some people have a little bit more trouble doing it in sitting, and some people find it easier laying down. So let's show the first one first. This is in sitting. This guy did a nice job shaving his head for our picture. So he's going to sit and tuck that chin back. So the focus is to keep the eyes aligned straight ahead and the chin tucks in, almost like if you remember when you were a kid and you made a double chin, right? Kind of that same movement of tucking in the chin as best as we can. And sometimes because of gravity, we don't get that one very easily. So there's also, you can do this in laying down too as well, which sometimes makes it a little bit easier. So let's watch this young lady here. She's on the floor, but if you're not comfortable getting down the floor, you can easily do it on the bed. You can see she doesn't lift her head. It stays on the floor, and she just tucks that chin in. So when we get that chin tuck action, what we're actually doing is trying to open up some of those spaces between the vertebrae to reduce the compression that's going on in between each vertebrae. And again, like I mentioned before, we'll get you guys that handout so you can start working on those. Be careful with this one. Sometimes if you force that chin back really physically, very quickly and fast, you can almost like whiplash your neck a little bit. So you have to be very careful that it's always a very slow, always very controlled type motion. One of the last thing we see is just general muscular neck pain. And so we can see from the picture here that we've got layers upon layers of muscles that are in the back of the neck and in the back of the shoulder blade area. So what we're looking at the top page top picture is, again, this gentleman, here's his back of his head, his ears, and you can see where these muscles attach. They attach kind of almost above the ears, which you would think that's the case, but that's where they end up. And here is a shoulder blade on one side. Here is a part of another shoulder blade on another side. And here is the big trapezius muscle that plays a big role in creating a lot of tension in the neck. And if we pull that away, we can see underneath it, there's these other multiple layers. You can see this one muscle called levator scapula and the rhomboids, major and minor. Those also are working on their job primarily is to pull the shoulder blades back. But you can see how there's a few different layers of muscles in the back area. And we not only have muscles in the back of the neck, we also have in the front. So you can see down lower with the person who's kind of looking up and towards the side, right below her ear, you'll see that there's multiple muscle layers in through the front of the neck, as well as around the jaw, and as well as around the side of the head. And so not only do we see people that have neck pain complaints, they may also have some complaints of some jaw pain or TMJ type symptoms. So they may clench their teeth or they grind their teeth and they're just, those muscles are just constantly in like just tight spasm areas. So that can cause some discomfort too. So this group of people is usually over the age of 25. They're sitting all day. A lot of students have this problem. They just complain of general neck pain. They also complain of some upper back, maybe stiffness or soreness. They're on the computer a lot. Obviously, students nowadays, everybody's on a phone. Everyone that's a student has a heavy backpack. So with these people, look at the same things. We're doing pain management. We're doing breathing, postural corrective exercises, trying to work their muscles through their upper back and core. And then we teach them how to stretch their neck. So here's our last two exercises, and these are neck stretches. So I'll show you these ones. The first one is a cervical side bending exercise. And you can see he's going to grab the side of his head, pulling his ear towards his shoulder. And you can see his body is still, so it's only the neck that bends. It's not the whole body. Sometimes people have a tendency to move their whole body to the side. It's only the neck that moves and not the whole body. And then the last one is just turning the head, just getting the head in a comfortable position and is turning from side to side. And you can see how she's able to do that, and she's able to keep her shoulders straight as she turns. We see a lot of people that are driving, and as they get older, they find they're trying to pull out. They can't turn their head far enough to look out the window. They actually have to turn their whole body to look out the window, which is, makes me nervous as a driver. But we need to be able to have that cervical rotation or twisting of the neck to be able to look over our shoulder, looking for oncoming traffic. So that's kind of that's a big one that we focus on a lot because of this guarding and tightness that these people end up having. They lose a lot of that rotation in the neck. All right, hope everyone's doing okay. We'll have a nice dinner when we're done, don't worry. All right, so now let's just talk briefly about posture. We need to focus a lot of that. We do focus a lot on that. Those of you that were on the call early today, I talked about this slide that I had in this presentation, and it just shows you what we're looking at is a person on their mobile phone, and when they have a straight posture, there's only 10 to 12 pounds of force on the neck. But you can see as the posture continues to get more forward and increase, the amount of weight that stresses onto the neck increases. 60-degree flex forward in the neck is a lot of flex in the neck. and look at the amount of force on that neck. So, gosh, that's an awful position. I hate to see that. We always want people trying to utilize their phone with their hand up a little bit higher to prevent that really forward bending position in their neck. It's just an awful thing to see. And so we're constantly getting people to try and say, listen, get off your phone, get off your phone, don't use it as much. But I think if we can get them, at least if they have to use it, get them maybe using an earpiece or just getting a little bit more upright with their body position will be a really helpful thing for them to do. And when we talk about posture, those of you old school people that know what a plumb line is, a plumb bob, contractors back in the day, to figure out if the wall was straight, they would have a little piece of metal down the bottom and on a string, and they would hang it from the roof, and they would figure out where is the line in the wall and is it nice and straight. Well, it's kind of the same thing when we talk about posture. We're looking, can we line up the ear through the shoulder, through the hip, through the knee, and through the ankle? And this is the part of our presentation when we do them live, where I have people stand up and we'll say, all right, listen, let's see who can work on just pulling those shoulders back, who can work on trying to line themselves side to side. And you see on the right side of the page, sometimes people have a little bit of a lateral shift or lateral curve because of a scoliosis or a curve to the side, or they're just significantly forward head. Their head is just too far forward. So then we want to try and say, hey, listen, let's get those shoulders back. Let's get the headline back with the rest of your body. So you can obviously see this is, laptops are people it helps to make people more mobile, but obviously using a laptop can create a lot more posture issues. So one of the things that we do is we talk a lot about changing posture. And nowadays, people have calendars on their computers or their phones, and you can set reminders or timers or egg timers or beeps or something where I want people recognizing that they've been sitting in a position for too long, and now it's time to move. And what's that amount of time? It's different with everyone, but usually around 20 to 30 minutes is a great time to get out of your chair and to move and to get into a different position. So the cartoon picture just shows what does a good workstation position look like. And you can see the eyes are at the top of the screen. He's able to let his arms rest on an armrest of the chair. His hand is supported on the table when he uses the mouse. His back is supported in the chair, and he's got good support from the front part of the chair and the back, and his feet are flat on the ground. So we spend a lot of time talking about these new high-low desks, which is something I wish I thought of 20 years ago, which I unfortunately didn't. But the one that we use in our office mostly is the one called FlexiSpot. And so the three pictures shows the person standing up, but you can easily lower that desk and sit. So all of my office staff, my office manager, all the office stations that we have in our office have this high-low table that you just flip a lever on the side. The whole desk raises up and allows the person to stand. So we're constantly getting people to try and get them, on my staff at least, getting out of the chair, standing up, being aware of their posture when they're either on the phone or they're with customers. And so we have talked a little bit, I mentioned some breathing before, and we talked a lot about this in our shoulder presentation earlier today, but I really firmly believe that a lot of neck pain comes from tension, and we carry tension in through the front of our neck, in through the tops of our shoulders, in through our upper back. And if so, we can learn how to reduce that tension, we can really make some nice improvements with our pain. And so you can see in the bottom picture, we see the skeleton, and imposed in there is the diaphragm. So the diaphragm looks very much like a parachute, and it's part of the core. We consider it to be the roof of the core. And so what I have people do, you can see the young lady is laying down. She has one hand on her chest, another one's on her belly. And as she takes a breath in through her nose, I'm going to encourage her to try to not breathe from her chest, but to breathe from her belly instead. And when she can breathe from her belly, it's now utilizing the diaphragm to breathe versus all of these accessory muscles that we have in through our chest and through the top of our shoulders. We don't want them working a lot. We want to get our breathing coming from the diaphragm. So what it does is it allows people to sit for 5 minutes, be quiet and still, and just focus on some breathing. And that breathing generally tends to a little bit more relaxation, a little bit less tension going through the muscles. So it's an awesome thing to learn, but it's also a really hard thing to master. So some of you that have tried some mindfulness in the past, it's definitely something that almost everyone goes through waves of doing it, then not doing it, and doing it, not doing it. I'm in a wave of doing it. I try to do, at least 5 to 10 minutes every day of some mindful breathing before I start my day. I really find it to be very helpful for myself and help me get centered and get myself ready for my day. And I would strongly encourage you to try it. And if you ever have a question, I'm happy to talk to you further about that individually. And it's because how our body handles pain. Our body's general response is to protect, always to protect. I use the analogy of a stove, a hot stove. You go into the kitchen, you don't realize the stove is on. You go to put your hand on the stove. Well, your body will never allow you to keep that hand on that hot stove. You pull away immediately and you guard and brace and protect away from that hot item. And that's what the body is constantly doing, is a constant stage of protection all the time. So if we can get people doing some breathing, getting them to relax, getting them to take that tension out of their shoulders, what we find is that they actually have better pain management. They have overall much less pain. It's very amazing. People come in and they're rigid and tight and stiff. We're like, listen, try to lay down, try to breathe, we don't want to say to them, hey, relax, just relax. That's the worst thing you can say. But we try to focus breathing as it's an exercise. And so we're just going to try this exercise. And our focus is to breathe from our abdomen and not from our chest. And then, excuse me, the last thing I always talk about when I talk about pain is, what I describe as something called a tweaky thing. And, many times we'll see clients, we start working with them in the clinic, and, we warn everyone that pain will make, you may get some pain from the treatment we provide when you start with, and that's very common. But people will come back in, they'll be like, no, I don't know, I was watching TV the other night and I had this shooting pain down my arm, and it came on for like 10 seconds and it was, wow, it's like, oh my gosh, what's that? And it came on, but then it went away. And like, what do you think that is? And I'm like, I don't know what it is. I'm not really sure. And I'll joke with them. I say, what? I think it's a tweaky thing. And they look at me kind of strange, like, what are you talking about? But the tweaky thing is something created some compression somewhere in that neck or shoulder, or in that area where you had that sharp pain, that it compressed and then it released. And that release made it go away. So I'm mostly concerned about when a tweaky thing becomes a trend. Every time I do this, I have that same pain. And that's a problem. That's when we have to sit down and go, okay, what's going on there? Let's see what we can do to try and get rid of that thing that's becoming more of a trend than just just comes on once and goes away. And this is what we see all the time, so it ends up that that person in the blue has increased pain, not enjoying themselves, doesn't want to engage with their family, worries about their work. And then that leads to some anxiety issues, works on their case. Hey, you're missing work. What are you doing? What's going on? They start to feel, they're not feeling well. They're becoming sick. It leads to they can't sleep. And now maybe they have to get on some medication. They end up having some other family issues. And then they just get into this circle of not really managing it, and they can't cope with it. It just leads to they just caught in this chronic pain circle. So we want people to recognize, one, that pain is normal. Number one, you have to understand and wrap your brain around that fact. We don't like it, but it's how our body responds to things. And so pain is normal, and low levels of pain are normal, but high levels aren't. And so when we have those high levels, let's focus on some things to get those high levels of pain down to low levels of pain, and then teach you some exercises to improve your general function to get you going in the right direction. And that can just lead to some nice fitness goals. What we're always hoping for when people are finished their physical therapy care is, can they continue? Can they keep working on something on their own? And so, what I feel adults over the age of 35, we need three things, in my opinion. One is we need to learn about what good posture is, and we need to learn how to stretch structures that are tight. So, as an example, we have that neck and shoulder pain. We spend a lot of time guarding, and that shoulder gets tight. And so we say, listen, relax those shoulders. Let's just rest those shoulders. And then let's stretch through that side of that neck and create some stretching to get that area to stretch through the side. And then we say to them, listen, so now we're moving a little bit better. Let's get a little bit more healthier. Let's get out and do some walking. Let's ride an exercise bike. Maybe go for a swim. Do something where you can work on getting your heart rate higher than your resting level. And so we always focus on teaching them, what's your max heart rate, which would be 220 minus your age. And the range that we're looking for is 65 to 85% of that maximum heart rate. So someone who's 50, that 170 would be their max heart rate. And something that's 65 to 85% of that 170 is where we want them to exercise and try to get their heart working towards. Some people, they've never been there in a long, long time. And so we don't immediately get them started with it. We take their time and we get them moving and try to get them seeing that, you can ride a bike and breathe heavy, and it is okay, and you'll be fine. And then the final piece is we need to do some resistance training. We need to build strength through resistance and bands and weights and balls and, machines and different things like that. So we maintain our strength, because as we age, we constantly lose strength. So what are we going to do to offset that loss of strength? And so those of you that have heard me do these presentations before, this is the time where I tell my story. And I think it's really important for us to really sit down and think about, what are we doing? Why we have neck pain? Because I really feel strongly that we've got to find people a way to get less pain. And sometimes we can help, sometimes we can't. I had a lady today. She's done yoga for her entire life, and she has a yoga person she likes and trusts. We've been working for about, a month, and she's like, it's just not working out. I'm going back to my yoga person because I think that's where I need to go. And I'm like, listen, if you think that's going to help you better than I can help, fantastic. Do it. Got to get yourself something that like and trust and you feel comfortable with, and then just run with it and just go with it. And so when we're at this point, you're on the call. So I'm assuming you're all on the call because either have neck pain, or you've had it before, or a family member or friend that's got it, and they just complain about it all the time. You're like, oh my God, stop complaining about it. Let's do something about it. So there's three things we can do. One is we can ignore it. And we've been ignoring it all along. Like I said, the majority of people that we see in the clinic, they don't come in with 6 days of neck pain. They come in with 6 months of neck pain. And it's only been getting worse. And we just think, we'll live with it. We're fine. It's no big deal. And then it gets to the point where, I can't sleep anymore. I can't get my work done. I'm tired all the time. I need to do something about it. And so we can either just try to alter it or tweak it or change it, or we can really accept that it's a problem and try to handle it and try and fix it. And so I have a friend, he's in Pennsylvania. He is a physical therapist and has a clinic very much like mine in a strip mall. And he had a patient and was working with the patient. And the patient said, hey, Bob, look at your ceiling tile's got a stain in the ceiling tile. You really got to get that fixed. And he was like, yeah, I'll deal with that later on. So, every time he kept seeing the patient would go, Bob, you got to fix that tile. And he was like, whatever. And put it out. Finally, he's like, you know what? I'm going to try and go to Home Depot and I'm going to get some ceiling tiles. I'll take that one out. I'll replace it with a new one. I'll just alter things a little bit, change it a little bit, but, just see what I can do. And so that worked until they had a heavy rainstorm. And guess what? Another ceiling tile stain. So he's like, that didn't work. All right, what am I going to do next? He calls his HVAC guy and says, hey, can you tell me I got a leak in my ceiling. Can you help me figure out what it is? And the guy goes up there and he goes, oh, it's not me, it's the roofer. And so then he's like, all right, fine. So he calls the roofing guy. And of course, what does the roofing guy say? Roofing guy goes, oh, it's not the roof, it's the HVAC. So now my friend is like, what the heck is going on? I don't know what to do. Where am I going to go? So he ends up gets the second opinion, right? Talks to someone else and he gets this guy who he knows. He says, tell me honestly what you think is going on. So the guy goes up there and he's looking all around. He goes, well, it's not your spot that's leaking. I found the leak. It's 2 suites down. So he goes down and he finds out that it's actually on the side of the building. It's leaking in, going through all the trusses and bam, ending up on his ceiling tile. The roof guy comes, patches the hole, everything's fixed. Heavy rain comes, no leaking. He's handled the situation. So it took him a while to get there, but once he got there, he got that ceiling all taken care of and never has a leak again. So what can you guys do that are on the call to try and maybe work on trying to handle this problem? Well, we have 2 things, in our office. One of them is a physical therapy evaluation. And Katie is on the call tonight. Allie's on the call. They're 2 of my office staff. They do an amazing job at helping our patients know if you have insurance, what is your insurance cover? Do you have to own anything? Things like that. What's the financial side of things? And what's the authorization and referrals and all that, craziness. But so if you really feel like, I've got to handle this, and I think the best way to do this is through an evaluation, we do those all day long. So between our 2 offices, we have 8 physical therapists currently working now. One's on maternity leave, but we've got 8 of us, and we all are very passionate about trying to help our patients get rid of their pain and move on with the rest of their life. And so call us. The number is, our Northborough number is 508-393-9000. Our Hudson office is 978-875-7500. I need to update my presentations with our new phone numbers. I haven't done it yet. And so call us up. We'll help you figure out all the insurance rigmarole, and then we'll get you booked out for some physical therapy sessions. You'll come in, meet with one of my physical therapists. They'll tell you exactly what they think is going on, and they'll set a plan for you to kind of move forward and get some treatment. You might be thinking to yourself, you know what? I don't know if I want to deal with my insurance. I'm not sure. I don't even know if physical therapy is right for me. Well, we offer what we call a free screen. And so the free screen is something where you come in, meet with our physical therapist. It's a half-hour session. We go through and we look at about 5 to 10 minutes of some Q&A, what's going on with you. Another 5 or 10 minutes of here's some specific tests and screens we can do to determine what have we found. And then the rest of the time is we spend time talking about what are we going to do about it. And usually, most of our people that come in for a screen, they fall into one of 3 categories. One is, they're currently doing some exercise. They have a program that they like, and we just have to tweak it a little bit. We just have to say, why don't you stop doing this? Try this instead. And if you have trouble, call us back. Sometimes the person's not involved with any exercise, and we think, maybe you need some treatment. It would be great if you could come in. We'll start working on your neck, shoulders. We'll get you moving in the right direction, in less pain, and make sure that you're feeling much better. And then we just have them start with an evaluation and go through that physical therapy process. There are some people, though, that we end up looking at them and seeing things, and it's like, something's not right here. And we're going to send you back to your doctor. So when we do one of these screens, we take all of your doctor's information down because we want to share with them what we found. So it's not just like we're going to take a look and tell you what it is and that's it. We share it with your doctor too. So that way, if you do need to go back to the doctor, we want them to be informed about what did we find to help them make the right decision on what is it that you need. So, we have the PT eval, which is more formal. That's an hour. The free screen is a half hour. I can see my typo in there. It says a free lower back screen. It's a free neck screen. And our screens can be for anything that we do. We actually also do a free balance and fall screen. I think in May, we'll be doing our balance and fall workshops, which are going back to be in person. So I'm very excited about that because I've had enough of Zoom. I'm sure you all have had enough of Zoom too as well. So, so I think I've spoken enough, and I'm not sure if anyone has any questions. If you do, you can just pop them in the chat. If you want to be unmuted to ask a question, I can't see the chat box from my end, so just let Katie know. Say, hey, Katie, can you unmute me? And then she can unmute you and you can ask a question. Is there anything in the chat, Katie?
No questions yet. Just, I believe that's Bill saying thank you very much, and that he'll see you in April.
Okay. I want to thank everyone for coming tonight. And again, just remember, let's work on trying to get things handled. It's super important. Let's not live with this, chronic pain. Let's do what we can to take care of things. And call our office. We're open tomorrow. We can help you set something up if you're interested. And again, just finally, two last things. You'll get an email from Katie on Monday with the presentation, the exercise sheets, as well as the link for the presentation. And then if you our next our April workshop is on lower back pain, and that's going to be towards the end of April. That will still be a Zoom call. And in May, we're going to go back to our in-person. We're going to do an in-person workshop in both locations, one in Northborough, which will be on a Saturday, and one in Hudson, which will be on a Thursday night. So we hope if we don't see you in the clinic for some PT, maybe we'll see you at a future workshop. So thanks everyone for coming tonight. I appreciate it. And if there's no other questions, have a great night, and we'll see everyone soon.
Yeah, Darlene says thank you. Joyce says thank you. And I don't see any
Great.
questions. So I think you covered it all.
Awesome. Great. All right. Thank you very much, everyone. Have a great night, and we'll see everyone soon.